Hello, and thank you for studying with me today. Today's lesson is going to be a brief overview of headaches as in a general topic. Now, headaches can have two different causes. Primary headaches mean there's no underlying cause, it's just a headache. And secondary means the headache is actually a symptom of something bigger going on, something like a stroke, a tumor, meningitis, or encephalitis. So primary headaches can be divided into different types, and it's based on where the pain is coming from. Tension headaches are muscular, migraines are vascular, and cluster headaches are neurologic. And then secondary headaches can come from whatever pathology is causing that headache as a symptom of something else. Things like referred pain from trigger points and tension in the neck and shoulders. There could be TMJ in the jaw that's causing pain, referred pain to the head. It can be something like from the sinuses or the ear or the mouth. All of these things can cause secondary headaches. Clinical manifestations or signs and symptoms of tension headaches include constant pressure and photophobia, which we call sensitivity to light. Cluster headaches means unilateral pain around the eye, so clustering on one area around the eye, one-sided. And migraines can have kind of more intense overall feelings, including auras, nausea, vomiting, photophobia. So migraines can cause a whole variety of things like mood changes, fluid retention, increased urinary output, uncontrolled excessive yawning, food cravings, auras, where they either taste something or hear something or see something before a migraine starts. And these can be very exhausting. Medical management first starts with diagnosis, and diagnosis of the cause of a headache will really depend on how bad the headache is. Everyone gets a headache once in a while from feeling tired and having that just primary headache. But depending on the symptoms that are going along with it, like nausea, vomiting, and aura, the provider may choose to do more in detailed testing to see if there is a secondary pathophysiology, a secondary cause of the headache. So history and physical will obviously be important. They may do blood tests, a lumbar puncture to rule out things like meningitis, a CAT scan to look for any abnormalities like bleeding or tumors in the brain, and the same thing for an MRI. Treatment will involve treating the underlying cause. If it's a tumor, treating the tumor. If it's a migraine, treating the migraine. If it's a cluster headache or tension, maybe they need some relief in the neck. If it's a tension headache, to help relieve the tension that's causing that. And then anti-inflammatory medication can be a great pain reliever for headaches. So medications can be a variety of things. This can be anti-inflammatories like NSAIDs, other pain relievers, analgesics like Tylenol or acetaminophen. Muscle relaxants are particularly helpful for things like tension headaches. Sedatives, antidepressives, and abortive therapy, meaning medications specifically targeted to stop migraines. And this is specifically for migraine type headaches. Complications of headaches can include medication overuse if someone has frequent migraines or headaches. And status migrainosus means a migraine that lasts longer than 72 hours. So let's go through the nursing process as we talk about headaches. So nursing management starts with assessment. So we're going to look at the signs and symptoms and really get to the root cause of the headache itself. Nursing diagnoses or nursing problems that we can help fix include things like acute pain, perhaps a knowledge deficit if the patient doesn't know about headaches or how to help themselves, or self-care deficit, because sometimes headaches come from things like chronic stress, lack of sleep. So as we think of our nursing interventions are always divided in Davis into actions, assessments, actions, and teaching. So what are the assessments we should make once we know someone has a headache? What are the actions we should take, and what teaching should we provide? So in terms of assessments, we're going to be doing things like vital signs, getting a full pain scale, finding out if the patient has any triggers for their headaches, what caused this headache to begin with, What kind of measures have worked in the past, and what is not only to stop headaches that are already there, but to prevent them from happening, and if the patient has any auras associated with their headaches. Now, actions to take will, of course, be about administering medications as ordered, but we also want to think about maintaining a calm, dark, and quiet environment, which can help alleviate the symptoms. Now, in terms of teaching, we want to teach about the importance of sleep, taking medications as prescribed, and avoiding any triggers. And in terms of evaluating care, how do we know when our care of someone with a headache is getting better and it worked? Well, the episodes of the headache are better managed. Maybe they're less frequent, less intense, and the medications are working. So, quick and easy lesson on headaches today. Thanks for listening, and I'll see you next time.